Iron deficiency anemia. It's not just about feeling tired, it's a hidden epidemic affecting millions worldwide, with some truly bizarre symptoms you wouldn't believe. Today we're diving into the strange world of depleted iron stores and their surprising impact on our bodies.
Oh, that sounds intriguing. What kind of bizarre symptoms are we talking about here?
We'll get this: some people with iron deficiency anemia develop a condition called pica, where they crave non-food items like ice, dirt, or even chalk. It's the body's way of trying to get minerals it's lacking, although obviously eating dirt isn't the solution.
That's absolutely wild. I had no idea the body could respond in such an unusual way to a deficiency.
Right? And that's just the tip of the iceberg. In severe cases, people might develop spoon-shaped nails, a condition called koilonychia, or get painful cracks at the corners of their mouth. It's like the body is sending out these strange distress signals.
It's fascinating how our bodies can manifest these deficiencies in such unexpected ways. But how common is iron deficiency anemia, really?
Well, it's actually more prevalent than you might think. According to the World Health Organization, iron deficiency is the most common nutritional disorder in the world. It affects more than 2 billion people. That's about 30% of the world's population. And what's really concerning is that many people don't even realize they have it.
Wow, those numbers are staggering. So how do doctors actually diagnose this condition?
Great question. It's not as simple as you might think. Doctors rely on a battery of blood tests to piece together the puzzle of iron deficiency anemia. They look at hemoglobin levels, which measure the oxygen-carrying capacity of the blood. In moderate to severe cases, hemoglobin might drop below 10 grams per deciliter.
And I'm guessing that's significantly lower than it should be.
Exactly. For women, hemoglobin should typically be between 12 and 16 grams per deciliter, while for men it's a bit higher, between 13.5 and 17.5. But here's where it gets interesting. Low hemoglobin alone doesn't necessarily mean iron deficiency. That's why doctors look at other parameters too.
Like what?
Well, one key measure is the mean corpuscular volume, or MCV. This tells us about the size of the red blood cells. In iron deficiency anemia, the cells are smaller than normal, what doctors call microcytic. It's like they can't grow to their full size without enough iron.
So our blood cells are literally shrinking because they don't have enough iron. That's pretty wild.
It is wild, isn't it? But the real smoking gun when it comes to diagnosing iron deficiency is a test called serum ferritin. Ferritin is a protein that stores iron in the body, and serum ferritin is a critical marker of the body's iron stores. In someone with iron deficiency anemia, ferritin levels are typically very low, often below 15 nanograms per milliliter.
That sounds pretty straightforward. Is there any reason why doctors would need to look at other tests?
Actually, yes, ferritin can be misleading in some cases. It's what we call an acute phase reactant, which means its levels can increase during inflammation or infection, even if iron stores are low. That's why doctors often look at other iron-related tests to get the full picture.
I see. So it's not always as simple as just one test. What other tests might they use?
Well, there's serum iron, which measures the amount of iron currently circulating in the blood. Then there's total iron binding capacity, or TIBC, which tells us how much iron the blood could potentially carry. And finally, there's transferrin saturation, which is the percentage of iron-carrying proteins in the blood that are actually carrying iron.
That's quite a lot to keep track of. How do doctors make sense of all these numbers?
It's all about looking at the pattern. In iron deficiency anemia, you typically see low serum iron, high TIBC, and low transferrin saturation. It's like a fingerprint for iron deficiency. But you know what I find really intriguing? The idea of actually looking at the blood cells under a microscope.
Oh, is that something doctors still do in this age of advanced lab tests?
Absolutely. It's called a peripheral blood smear, and it can provide valuable visual confirmation of iron deficiency anemia. Under the microscope, the red blood cells look smaller and paler than normal, and they might have unusual shapes. It's amazing to think that we can learn so much just by looking at a drop of blood.
It really is fascinating how much information we can glean from these tests. But I'm curious, how does all of this translate to the everyday experiences of people with iron deficiency anemia?
Well, think about it this way. Iron is crucial for our bodies to produce energy. When we're iron deficient, it's like trying to run a car with a nearly empty gas tank. People might find themselves exhausted after minimal exertion, struggling to concentrate, or even feeling depressed.
That sounds pretty debilitating. I imagine it could have a significant impact on someone's quality of life.
You're absolutely right. And for many people, these symptoms might creep up so gradually that they don't even realize something's wrong. That's why awareness is so important. Many people, especially women who lose iron through menstruation, might chalk up their fatigue to just being busy or stressed. But iron deficiency anemia is a real medical condition that can significantly impact quality of life.
It's a sobering reminder of how important it is to pay attention to our bodies and not dismiss persistent symptoms. But on a more positive note, iron deficiency anemia is treatable, right?
Yes, it is. Once diagnosed, treatment usually involves iron supplementation and addressing any underlying causes, and the improvement can be dramatic. Many people report feeling like they have a new lease on life once their iron levels are restored.
That's really encouraging. It's amazing how something as simple as having enough iron can make such a big difference in how we feel and function.
Absolutely. And that's why understanding conditions like iron deficiency anemia is so important. It's not just about medical knowledge, it's about empowering people to recognize potential health issues and seek appropriate care.
Speaking of recognizing health issues, are there any particular groups of people who should be especially vigilant about iron deficiency?
Great question. Women of childbearing age are at high risk due to blood loss during menstruation. Pregnant women also need more iron to support the growing fetus. Vegetarians and vegans might be at risk if they're not careful about their diet, as plant-based iron is less easily absorbed than iron from meat. Athletes, particularly endurance athletes, can also be at risk due to increased iron losses through sweat and the breakdown of red blood cells during intense exercise.
Wow, that's quite a diverse group of people. It really highlights how widespread this issue can be.
Exactly. And it's not just about recognizing the symptoms, it's also about understanding the potential causes. While inadequate dietary intake is a common cause, there can be other factors at play. For instance, some people might have trouble absorbing iron due to conditions like celiac disease or inflammatory bowel disease. Others might be losing blood due to conditions like peptic ulcers or colorectal cancer.
So iron deficiency anemia can actually be a sign of other underlying health issues.
Absolutely, that's why it's so important for doctors to investigate the cause of iron deficiency, especially in older adults or people without obvious reasons for iron loss. It's not just about treating the anemia, it's about uncovering and addressing any underlying health problems.
This really underscores the importance of regular checkups and blood tests, doesn't it?
It certainly does. Regular blood tests can catch iron deficiency before it progresses to anemia. This is especially important because the symptoms of mild iron deficiency can be so subtle. You might just feel a bit more tired than usual, or find it harder to concentrate, things that are easy to brush off in our busy lives.
Is there anything people can do to prevent iron deficiency in the first place?
Great question. Diet plays a crucial role. Including iron-rich foods like lean meats, seafood, beans, and leafy greens can help maintain adequate iron levels. For those following a plant-based diet, it's important to pair iron-rich foods with vitamin C, which enhances iron absorption. So, for example, you might add some citrus fruit to your spinach salad.
That's a helpful tip. Are there any foods that might interfere with iron absorption?
Actually, yes. Calcium can interfere with iron absorption, so it's best not to take calcium supplements at the same time as iron-rich meals. Tannins in tea and coffee can also reduce iron absorption, so it's a good idea to wait an hour or so after meals before enjoying these beverages.
It's fascinating how complex our body's relationship with nutrients can be. Is there anything else our listeners should know about iron deficiency anemia?
I think one of the key takeaways is the importance of listening to your body. If you're feeling persistently tired, weak, or short of breath, don't just write it off as stress or lack of sleep. These could be signs of iron deficiency, anemia, or other health issues. It's always worth checking with a healthcare provider if you have concerns.
That's excellent advice. It's clear that iron deficiency anemia is a complex condition with wide-ranging impacts.
Absolutely. And remember, while we've covered a lot of ground today, this is just scratching the surface of what's known about iron deficiency anemia. Medical science is constantly evolving, and new research is always uncovering more about how our bodies work and how we can best take care of them.
Well, it's been an eye-opening discussion. Thank you for shedding light on this important topic.
It's been my pleasure. We hope our listeners have found this discussion on iron deficiency anemia informative and maybe even a bit surprising. Remember, knowledge is power when it comes to your health. Stay curious, stay informed, and don't hesitate to ask questions about your well-being.